this webinar. Bret?
You all set, Luke?
Yes, I'm all set. Go ahead.
Okay. Okay, so this is a coronavirus 2019 presentation. As you can see on the screen, my name is Bret Haner. I'm the Emergency Preparedness Coordinator for District Health Department number 10. Just to give you some background in terms of what is coronavirus, it's a family of viruses. So example, the common cold, SARS, and MERS are all part of this family of diseases. They are similar, but they are not the flu. So it is a different virus than the flu that we see on an annual basis. You may hear two different terms for this virus and disease. So I just wanted to be clear that if you hear the term SARS-CoV-2, they're talking about the actual virus. And if you hear the word COVID-19, they're talking about the disease. So as an example, H1N1 is the virus that causes flu. So in this case, it's SARS-CoV-2 virus that causes COVID-19. Most likely, the origin of this disease is a bat, because this coronavirus is a beta coronavirus, and that group of viruses is normally found in bats, but we may never actually know where this originally started from. So the next question is, why the concern? And there are a couple issues with that, and one is that this is a brand new virus. So one concern is that there is no vaccine at this point. A second problem is that we don't know how bad this virus and this disease will become, because it hasn't been here long enough. Our sample size in terms of who has the disease, who's died from the disease, how many are infected with the disease, are very limited at this point. So we don't know right now if we've seen the worst of it or if it's just getting started. We don't know what the fatality rates will end up being at the end. So those are some of the concerns that we have. And then there's kind of a misnomer out there with this word pandemic. And a lot of times the media and the news use it as like, if we have a pandemic, it's something terrible. But just so you all know, the word pandemic, to meet that definition, it just means that the virus has to be something we haven't seen before, so it's brand new, and it's widespread, generally across the globe. If you meet those two criteria, you've met the definition for pandemic. So it has nothing to do with how severe the disease is or how many people it kills. Okay, what is the current situation? This coronavirus started in Wuhan, China. Right now there are level 3 travel notices for China, Iran, Italy, and South Korea. And what that means is our government is telling U.S. citizens not to go to those places because the disease is widespread and you'll put yourself at risk. You can see the CDC and the MDHHS websites for current world, U.S., and Michigan numbers. And I don't list those in this presentation because they change every day. But I did look just about an hour ago, so I'll give you, based on an hour ago, what the numbers were. So in the U.S., the total cases are 938, with total deaths of 29 at this point. And in Michigan, the patients under investigation are 77. We've had 57 negative tests, and we now have 2 who have tested positive in Michigan. So Michigan is now included in the states that have coronavirus, COVID-19. One of the criteria, or the criteria for being a patient under investigation, has to do with your travel history, contact with confirmed cases, showing signs and symptoms, and ruling out other diseases. So if you went to your doctor, they would check you for the flu first before they would authorize testing for COVID-19. So based on those criteria, if you meet those, then they would put you and consider you a patient under investigation. Then I get a lot of questions about why are we so concerned with COVID? And because there are a lot more deaths with the flu. So to give you some perspective, in case you weren't aware of this, the flu virus on average kills 50,000 Americans every year. So that's every year. And that can range, a couple of years back, we had it at 80,000 in 1 year, deaths from the flu. So right now, the COVID deaths are nowhere near the amount of deaths that we have with the flu. However, the COVID-19 may end up having a higher fatality rate because right now it does. The low sample size, the numbers that we have currently, it's indicating it's in the 3 to 4% range in terms of the fatality rate, whereas the flu is in a 0.1%. So 1 for 1,000 is what we normally see with flu, and we're seeing 3, 4, 5 deaths per 100 with COVID. So that, in epidemiologic terms, is a huge jump. That's a significant change, significant number. So we are concerned with that. All right, symptoms. They can range from none, mild, to severe, and it all varies by person. I was just watching a news segment where they were interviewing one of the guys that's on the quarantine on a cruise ship, and his wife has symptoms, and they tested her, and she tested positive. But since he's in the same room with her, they tested him too, and he tested positive, but he has 0 symptoms. So he is a person not showing symptoms, but testing positive. Flu-like. So it's the fever, cough, shortness of breath. Those are the main symptoms. There can be others, but those are the main 3 that indicate that this is a COVID-19 illness. Okay, a couple problems with that. Problem number 1 is that this COVID-19, particularly in the elderly, has caused pneumonia-like illness that leads to death. And then problem number 2 is that a person may be infectious before they're symptomatic. So what that means is before they even realize that they're sick, they can be spreading the disease to others. So on a public health side, that makes it very difficult to contain and or stop the spread of the virus, because if we don't even know who's sick, we can't quarantine them, as an example, or isolate them. All right, let's talk about how the virus is spread. So this is a nice picture of someone sneezing and what that would actually look like if they didn't cover their mouth. So for those of you, this is primarily a school presentation, so I'm sure that most of you are experts on how illness is spread in the classroom based on that kind of stuff, kids sneezing and not covering. But this virus is spread by respiratory droplets. So droplets get in the eyes, nose, or the mouth from a sick person who is sneezing or coughing. Droplets on surfaces like doorknobs or gas pumps can also transmit the disease. So if someone touches, let's say, a doorknob that someone with COVID-19 contaminated, the non-sick person now gets that virus on their hands, and let's say they go and eat lunch, eat their sandwich without washing their hands, they've now ingested the virus and they're likely to become infected. This COVID-19 is not considered airborne, versus there are diseases that are, like TB and measles. So my analogy, kind of an explanation of how that differs from respiratory droplets, is smoke in a room versus baking flour in a room. So if you picture yourself at the front of a classroom, kids in their rows of desks, and you put your 2 hands into a bag of flour, and you're up by the chalkboard, and you're facing the students, and then you just throw that flour up into the air. Some of that flour would probably get to a couple of the kids in the first row, and maybe it will reach the second row, but basically everybody else past them, none of the flour would get on them, because after 5-6 feet, the flour is just not going to be able to go that far. So it's going to be in the air for a little bit. It will settle out and land on their desks and on the floor and on their backpack. But after a couple minutes, there won't be any more flour in the air. That's an example of a droplet transmission. So someone sneezes, it goes out for about 6 feet or so, but eventually will drop to a table or something. It won't be floating in the air. Now, opposed to measles, that would be more like someone smoking a cigarette in your classroom. So if someone came into your classroom, started smoking a cigarette, everyone in that classroom would smell that, no matter where they are, in the very back row in the corner. And what makes it even worse is that 2 hours later, someone else who walked into the classroom would smell that smoke too. It would still be wafting around in the room. And that's what measles does. Measles is a very contagious disease, and part of that is because if someone coughs or sneezes while they have the measles, someone who's unvaccinated can walk into that room 2 hours later and get infected. So that's kind of how this COVID-19 virus works, is not the airborne route. It's not floating around in the air. But if you're in contact with that person's sneeze, or you pick up your pen off the table and there's disease on that table, virus on that table, you could then eat a sandwich and be infected. Survival on surfaces, and right now, again, because we haven't had enough time to study the virus, we don't have a large enough sample size, so my next bullet has to do, or is based on other coronaviruses like SARS and MERS. But in those types of coronaviruses, studies have shown that they can last a couple hours up to a couple weeks on a surface. And they are humidity and temperature dependent. Generally, the cooler and less humid it is, the easier it is for a virus to survive. So again, for this COVID-19, we don't know specifically, but it's somewhere in that range. Cleaning and disinfecting. Okay, so the question is, what product can we use at the school when we want to disinfect? And according to the CDC, you want to use an EPA-registered hospital-grade disinfectant. So as long as it meets that standard, it should be fine for disinfecting coronavirus. How often you want to do it? The CDC kind of gives some vague terminology, and I pulled these right off one of the CDC fact sheets, and their terms were routine cleaning and facility policy. So it kind of leaves some gray area up into what your expectation is for that, but basically it's whatever your normal facility procedure is, that's what you should be following for disinfecting. Now, disinfecting is important, but it is not a fail-safe. So cleaning reduces exposure by killing or removing the viruses that are on that table or on that drinking fountain, so that everyone else who comes after that and uses the drinking fountain after you've cleaned it, they won't get the virus on their hand. But the problem is, as soon as someone who does have the virus on their hand uses that drinking fountain again, everyone else that comes after them will be exposed to the virus until the next time it's cleaned. So generally in this type of application, the more the better. So whatever you can feasibly do is what we would probably recommend. All right, the next two slides, I want to give you a little bit of idea of what we're doing on the public health level, both from a response and a preparedness perspective. And then I'm going to end with a couple of specific guidance recommendations for schools. So, current public health response, we have airport quarantine stations, 11 of them around the United States. One of them is in Detroit Metro. So as travelers are coming in from these countries that are experiencing widespread coronavirus, we are then funneling them through these airports and doing screening on them to determine if they need to be monitored once they're here. And the traveler monitoring is of non-sick individuals that we think may become sick eventually. So they're categorized by risk level, and you can see there on the screen it says none, low, medium, and high. And that all relates to, where they're coming from and who they've had contact with. But if they are put into the monitoring program, what happens is they're allowed to go home, but they're asked to reduce travel, and there's actually a couple different criteria depending on what risk level they're in, but they will be in the monitoring program for 14 days. And the reason for the number 14 is that is what we believe the incubation period is. An incubation period means from the time you were exposed, so someone sneezed on you, to the time we expect you to get symptomatic, if you're going to get sick, will be no later than 14 days. So we're saying if you're exposed today and you make it 14 days and now it's the 15th day, we're saying you are not going to get sick. You got lucky and you made it out. The health department contact for those people in the monitoring program is twice per day. So we're asking them just general questions like how you feel, any status change, what's your temperature, looking for a fever, that sort of thing. And then testing. Right now, it's on a case-by-case basis because we have a limited supply of testing kits. But the government has put rush orders on getting more, so in the next days and a week or two, we will most likely end up with all that we would need. But right now, we're on a limited basis. But that test is just a simple swab, and it goes to the lab, and the actual test is 4 hours. But depending on the backlog at the state lab, it could take a little bit longer than that to actually get the result back. But eventually, like I said, once the kits are manufactured and distributed out like they intend to here in the next week or two, it will eventually be opened up to all healthcare providers, and if someone wants to get tested, they will be able to. Right now, there's a little bit of a request process. The request needs to be approved, and again, that just goes back to the limited supply of testing kits. Okay, a couple other things we do is we're really trying to do a good job on public information. So that's things like media requests, fact sheets, group presentations like we're doing today to make sure that our community has the information that they need regarding this virus. Okay, in terms of public health preparedness, we've done a couple other things. So initial measures and recommendations are things like we're promoting hand hygiene and respiratory etiquette. So those are fancy words to say wash your hands and cough or sneeze into your sleeve or a Kleenex. And I'm going to talk about hand washing here in more detail in a second. Social distancing, if you hear that term, that just means we want you to stay at least 6 feet away from other people, particularly if they're sick, because that gets in that, out of that sneeze realm and cough realm where those respiratory droplets would be able to reach you. The other big thing we want to promote is when people do feel sick, they should stay home, because that's one of the best practices for not spreading this disease is staying home yourself so you don't give it to anyone else. Masks currently are only indicated for patient care, and those are N95 masks. So that's the ones you've seen that are kind of like a painter's mask. They're round. So right now we're only recommending healthcare entities, staff, use those N95s. We are not recommending those for the general public because really, unless you are coming in contact with someone with COVID-19, there's really no reason to have the N95 mask on. And then related to that, I'm sure in the news you've seen, like when they have coverage of China and some of those other countries, lots of people are walking around with the more rectangular surgical mask. And really, that doesn't help the person who's wearing the mask because it doesn't have a sealed fit around the entire nose and mouth. So viruses that, for example, are sneezed out could get around that surgical mask and you would get infected anyway. However, what it does do is it can help prevent spreading the illness to everybody else around that person, because if they cough or sneeze and they're sick, it's going to go into their mask versus out towards other people. Okay, my next bullet says mass clinics and what we call point of dispensing. So vaccinations are quite a ways out right now. It may be 12 to 18 months. And when we do get vaccine, it will be in limited supply. So a couple things on that. The reason for that length of time is once they develop and manufacture the vaccine, they then have to do trials. So they have to make sure it's safe and that it works. So that's what takes so long. Once they do those trials and they determine, yes, this is, I think I lost my screen. Give me a second.
Just bear with us while Bret gets back online. Thanks.
Okay, should be up here in a second. Okay, so I gotta get back to vaccine. Okay, so once those trials are done and the vaccine is considered effective and safe, then they will start distributing it and ramping up manufacturing of it. But like in 2009, when we had H1N1 pandemic, they can't make 300 million doses of that all in one shot. So they'll make, whatever the number is, 100,000 or 500,000, whatever the number is, in batches, and then they will ship those out. So what happened with H1N1 is District Health Department number 10 would get a supply of H1N1 vaccine, like about 1,000 doses on Tuesday, and then we'd get 1,500 doses on Thursday. And the government put together a priority list. So at that time with H1N1, it was pregnant women were at the top of the list. So we vaccinated all the pregnant women first, and then we went to the next step. I would imagine this will be something similar to that, but on this list, it's going to be the elderly, particularly over the age of 60, but I'm seeing numbers where like it's primarily at the 80-year-olds and above level. But they would be our priority to get the vaccine to once we have it. A couple other things we can do under the public health code are public health orders. And I just wanted to mention two of them. One is quarantine and isolation. And we can do that for individual or groups. So what that means is if someone is sick with COVID-19, my health officer can implement a public health order to mandatorily quarantine that person at their house. So what that means is they're going to be told, stay at your house for 14 days and make sure you limit, no visitors, that sort of thing. If that person then defied that order, and let's say they decided to go to the grocery store on Tuesday, and we found out about that, we could go to the court and, by penalty of law, enforce that with law enforcement, where that person's now, basically under guard. Another thing that we have at our disposal is suspension of public gatherings. And for those of you who were on before I started, that's where I was mentioning they're starting that process now. So the governor has requested suspension of public gatherings in the state, and then some of the local universities have voluntarily suspended classes. So that's kind of what we're talking about here. So under the public health code, my health officer could go to a school system and say, because we're concerned about the spread of this virus, we are closing school. And then whether or not the school agreed with that, they would have to do it because it's a public health order. But obviously, we would want that to be in partnership with the school when we do something like that. All right, now I want to talk specifically about washing your hands. So my slide says, don't be gross, wash your hands. And here's why I'm bringing this up. because I would bet, based on just my observations out in the community, like when I'm at a restaurant or at a hotel or what have you, and I observe people washing their hands, most of them do not do it right. So I think I think we need to do some education about how to correctly wash your hands, even though it sounds like that's something basic. And then because this is a school call, I would really like the teachers, the school systems that are on this call to actually do some education in your classrooms to your kids about how to wash their hands, because I just don't think as a society we've necessarily got the message. So let me cover some of the basics, and maybe you'll find that that's something you hadn't thought of either. So one of the questions I get is, does it matter if it's hot or cold water? And the answer is no. The temperature of the water doesn't matter. All that the water is doing is helping you spread the soap around your hands and then rinsing the soap and the viruses or the dirt off of your hands once you're done scrubbing. So that's the only purpose of the water. The important thing is to actually use soap. So you've probably seen people yourself at a faucet where they go and they turn on the faucet and they just get their hands wet and turn the faucet back off and leave. That did basically nothing. And it might even be worse than not washing your hands at all, because you'll see my third bullet when I talk about scrubbing. So it's very important that if you're going to wash your hands, that you use soap, because the process of soap on your hands loosens up the dirt, or in this case, the viruses that we're concerned about, from the skin. So then as that soap loosens it up.
Meeting, that's Skype. And
just so you know, I can hear someone talking on the background, so if your phone's not muted, go ahead.
I went and
Okay, so,
I just muted them.
Okay, thanks. So once you've used the soap and you've got it spread around your hands, the next important piece is to scrub it for at least 20 seconds. They found that if you don't go for 20 seconds, you're probably not doing it long enough to actually scrub the virus off. So picture, for those of you who watch medical shows on TV and the doctor, the actor who's playing the doctor goes in and is getting ready for surgery, they're just scrubbing away at their hands, both arms, and then they use their elbow to turn the faucet off. That's what we're talking about. So scrub your hands for 20 seconds vigorously. Then here's the key, and this is where in my observations, watching other people wash their hands, that most people miss this step or do this incorrectly. And that is, once you've lathered up and then you've scrubbed for 20 seconds and then you put your hands under the running water to wash the soap off, don't grab the faucet handle again. So you want to grab some paper towel and then turn it off with your paper towel. Because whatever is on that handle, either from someone else who is before you or maybe what you had on your hand in terms of viruses, bacteria, whatever's on that handle, after you wash your hands, if you touch that handle again, you just put it right back on your fingers. And then the same goes for the door. So I've seen people wash their hands, turn the faucet off with their paper towel, throw the paper towel in the garbage can, and then grab the door handle, because they have to pull it in to exit, grab the door handle with their bare hand. So the same thing with touching the faucet. You touch that door handle, you've now put whatever is on that door handle back on your hand. And then while we're at it, a couple other thoughts for you is think about what you yourself have done at going out to eat, like at a fast food restaurant. Think about the ketchup dispenser at Burger King. How do you dispense that? Most people just put their whole palm on the top of it and pump the ketchup out. Well, just about everyone.
Brett, did you get bumped off? Because there's no volume. Folks, just bear with us while Brett gets back on.
Luke, can you hear me?
Yep, I can hear you now.
Okay. Don't know what happened. Sorry, folks. IT issues. Just dropped the line. So I'm back. So I was just talking about the ketchup dispenser, and they think about the pop machine. So you're going to get your Diet Coke. What do you press that Diet Coke button with? You know, if it's the tip of your finger, or is it knuckle, or is it the fist pump like we're doing now instead of shaking hands? So just some things to think about in terms of how we manage keeping our hands clean. So hopefully some of that was useful. These are just a couple resources, and I'm not done. I have 2 more school slides, but that's my general population presentation that I give. I don't include the school slides when I'm out in other groups. So these are the 3 resources that I provide to them. This is for you as well. And this, I don't know if I remember at the beginning if I mentioned this, but we are recording this, and we're going to post this presentation onto our DHD10.org website. So if you want to go back and review it, or if people in your school system weren't able to attend, they can go back once we upload this, and they'll be able to view the presentation. Okay, last 2 slides. I want to talk about some school-specific considerations. So first is illness screening. Because we don't want kids who are sick at school, we want to send them home. So a couple of ways to kind of monitor that is, one is possibly implementing screening as the kids arrive in the morning. You may have seen on the news, like over in China, where they're using handheld forehead thermometers. It's just a real quick, 3 seconds, and we get their temperature from their forehead. Maybe something like that to screen out kids who may be coming into school who are sick in the morning as just an option. Another one is having teachers and other staff and to keep an eye out for kids that may not be looking as well as they should. Then asking them, do some screening, asking them, do they feel well? Maybe sending them down to the school nurse or the secretary in the office to get a temperature reading. And then based on that, if either a kid self-identifies as being sick or a teacher notices them being sick, we want to get them out of the general population as soon as possible and into some type of holding location, because we want to keep the sick kids away from the well kids and staff so that we reduce the spread of this illness. School dismissal of kids is another option, and this is where the kids go home, but we would have the staff remain to continue through the workday, but we're greatly reducing the number of people in the building if the students aren't there. And then the next step would be actual school closure, where nobody, it applies to everybody, so nobody's going to school that day or for the next week or what have you. And then with both of those options, it's recommended from the CDC that schools start preparing and looking into options for some type of web-based educational training for students who have that access at their home. So for those that do have internet access, they could continue with their education on a web-based platform versus face-to-face. Okay, and then my last slide is a couple of additional steps. One is that if you haven't done it already, you want to confirm and or test your notification system and plans for notification at your school. So for all kids, staff, and parents, to make sure that you can notify them appropriately when need be. And here's kind of a big one from our public health side, and that is when dealing with the media, we as a community, want to provide one consistent message. So we would ask your school administrative staff to instruct your teaching staff not to talk to the media. So if they get a media request, they're walking out to the car at the end of the day and 9 and 10 News is in the parking lot, we would ask them not to grant an interview, just send them to your designated administrative staff to handle that request. And then for the school system administrative personnel, we would ask that you collaborate with DHD number 10 to do things like joint information releases or a joint press conference or that sort of thing, so that the school isn't saying one thing and the health department isn't saying another and the hospital is saying something totally different, because then none of us look good. Okay, next bullet is soften penalties for absenteeism. And what we're getting at here is, obviously right now we want kids in school normally. We don't want them missing. So schools will have penalties for kids missing school. But in this type of situation, if someone is not feeling well, they're sick, they potentially have COVID-19, we don't want them coming to school, even if they're on their last approved absence, and their next one they're going to get detention. In that case, we still want them going to school, and we would ask the school to lessen that penalty, take that detention away from them because they're missing because they don't feel well. Clean and disinfect more often. So, like I talked earlier about what your normal policy is, maybe it's twice a day, at 11 o'clock and 2 o'clock. Well, now maybe it's every hour or every half hour or whatever you deem appropriate. And then, like I gave you a demonstration of washing hands correctly. We would ask that those that can to actually do an education process in your school with your students on the correct way to wash their hands, and then everybody would be better off for that. So that's the end of my presentation. And this last slide are just a couple of additional school-related resources that you might be able to use. And you can see here, these are most of these are pandemic flu-related. The reason for that is COVID-19 is too new, so we don't actually have COVID-19 plans, but the virus is very similar to flu in terms of transmission and people getting sick and that sort of thing. So basically what you do to plan for a pandemic flu would work just as well for COVID-19. Okay, Luke, so I am done talking. So if you want to start the question process, we can answer questions for the rest of the time.
Very good. Thank you, Bret. At this time, we're going to open up the line for everybody to ask questions. If you are online, what I will ask is that you type your name and the word question in the text box, and I will call out your name. You will then go ahead and unmute yourself and ask your question. And Bret, I do have a question that was just typed in. Does DHD 10 have any money or resources for thermometers and probes for the current thermometers?
Yep, unfortunately right now we do not, but you may have heard on the news that the federal government has authorized, I think it's $8.3 billion to go towards COVID-19 response. And we don't know at this point what that looks like in terms of at the local level, what money we would get from that or what that money could be used for. But that's something that down the line here shortly may be something that we could pay for out of those funds. But the current answer to that is no, the health department does not have funds to purchase that type of supply for school systems.
Okay. And a couple more questions are coming in. They're actually just being typed in. Scott Ackham, who does not have a microphone. What is the health department's advice on school trips, for example, banned going to Disney?
Okay, right now, and I know this isn't a good answer, but the answer is we don't have state guidance yet on what they're recommending for us local health departments to tell our local schools. So unfortunately, I don't actually have an answer for that. But what I can tell you is based on what's been happening today, I would imagine that shortly the recommendation is going to come down that you postpone those types of trips. But I can't tell you right now that DHD number 10 is telling you to cancel that trip because we have not received any guidance on it. But that's, especially after today, that's the direction that it looks like it's going.
I have a question from CJ typed in: supplies for disinfecting and such, where can schools get them?
Yeah, that is a good question. I don't have an answer to that, so I will add it to my list to check into. So can you type your, if you haven't already, your name? I can't see the question, so Luke, you'll have to get this to me, but can that person type their name and what school system they're with, and I will follow up.
Joe Bauman is asking, can we obtain clarification regarding suspension of mass gatherings? Any examples or numbers would be helpful.
Yep, right now, I have not seen the official notice from the governor, so I don't know what actually she is talking about in terms of a mass gathering. And at this point, the information that it was texted to me by my medical director, and in her forwarded text message, it said the governor's requesting that we suspend mass gatherings. So it's not actually an order. So again, unfortunately, I can't give you an actual answer because we haven't seen the official order. But what I'm guessing is she's talking about things like sporting events, concerts, things along that level would be my guess, but I do not have that information at this point. And back to the person who was asking about cleaning supplies, definitely check with your janitorial staff. I'd have to believe they would know. And if they don't, we can look at some other avenues to try to answer that question.
And I just emailed their contact information to you, Bret.
Okay, great. Thank you.
Another question: if one child is sick, should we send all siblings home from that family?
So yes, if a family member was to test positive, then what would happen is we do what's in public health, it's called contact tracing. So we would look at who has had direct contact with that person, generally, within the 6 feet type of situation, but who has had contact with that person from the time that we feel they were sick. And all of those people, whether it's family members or not, would be put into the 14-day monitoring self-quarantine. So to answer that question specifically, yes, if there are 3 kids in the family, one of those kids tests positive, we would be sending the other 2 home.
And Janine Taylor just posted something on the chat from the EPA.gov.
For the cleaning?
Yes.
Okay, great. Thanks, Janine.
A question from Bob Grover: with universities not returning from spring break now, should we be prepared for the same after our breaks? If so, how long?
So again, we don't have specific guidance from the state, so I don't want to tell you something that ends up being not correct. But I'll give you my opinion. And my opinion is, yes, if this continues, we now have the 2 cases in Michigan. If tomorrow it's 12 and the next day it's 50, and it looks like it's continuing to spread north. For those of you who don't know, the 2 cases were down in southeast Michigan. So if it looks like we're headed to widespread of that virus in Michigan, I would envision that K12 schools would fall into that same category that the universities are falling in right now. And I would expect that we would be doing some of that canceling of schools here shortly. But what I'm saying is that I'm not telling you we are, and I'm not telling you it's going to happen. What I'm saying is that we should be preparing for that. And if that call happens, let's say on Friday of this week, what does that then mean? Are we prepared to implement that? Or because it might be this Friday, it might be next Friday, or it might not happen at all. Unfortunately, this is a fluid situation, and we don't know at this point. But we need to prepare. And I guess let me think about the other part of that was for how long. I can't remember if it was, I was looking at info on Central Michigan University or if it was Michigan State, but one of them said in their notice they're canceling, so kids are not to come back after spring break. And then if I remember right, I think they were going to make a determination like right now they said, and at the next Friday we'll determine if they're coming back for the next week, that kind of thing. So again, it's not a very good answer because it isn't an answer, but it's basically just going to depend on what the situation is looking at. And if we're canceling this week, come Sunday, we may be canceling the next week, and come Friday of next week, we may be canceling the next week. It just all depends on what the virus spread is looking like.
I have a message or a question from Justin. To review, it is possible for staff who are traveling over spring break to be stopped at DTW, screened, and ordered to self-quarantine. Are individuals who are told to self-quarantine required to notify their employer?
That's a good question. And in terms of the process, yes, if you were a traveler who was funneled through one of the 11 airport quarantine stations, and then you are deemed in one of those risk categories, you would be able to go home, but you would be instructed to contact a local health department. But to be honest, I don't know. That's the first time I've had that question about, are you required to tell your employer? And my guess is that probably falls on what we call HIPAA, which is if you don't want to, you don't have to share your personal health information. And again, don't take this as gospel, because I'm just kind of thinking off the top of my head. But my guess is you do not have to tell your employer. But I'm writing that one down, and I will do some follow-up on that one too.
Okay. Next question from Joe Bauman. Will there be an updated letter to parents from the DHD-10 as a result of the new cases of coronavirus in Michigan?
Janine, hopefully you're still on. Can you do the *6 and maybe answer that? And I'm referring to Janine, who is our DHD number 10 Public Information Officer. She's the one that is kind of coordinating our information that we're distributing. So I'm going to see if she has an answer for that.
I unmuted myself. Can you guys hear me?
Yes.
Okay, yes, I will reach out to our medical director, Dr. Morse, who drafts the letters, and we will get an updated letter drafted and ready to distribute to schools to send for parents. And again, as you all know, tomorrow it could be 3, the next day it could be 5. But yes, now that we do have cases in Michigan, we'll make sure to send out a letter with more guidance for parents.
Thanks, Janine.
You're welcome.
So Steve Dean is asking a question. He says, so I hear you say for ILI students, all are to be sent home or only when COVID-19 test positive?
Okay, so if I'm following that question, we're saying, like, going back to that family situation. So there's a student that tests positive, and I can't say for sure because again we don't have the state guidance. But my understanding is if there was a student who attended school, and I'm going to give you a hypothetical here. They're in school. It's the 4th period. They aren't looking good. They go to the office. They say, I'm feeling bad. I need to go home. They go home. And again, it would have to fall under, they would have to meet the criteria to even get tested. But let's say for hypothetical sake, the healthcare system that they go see says, yes, we're going to test you. And they test positive. My understanding is that we, public health, would do contact tracing. So like the students that were in their class, the students that were in their lunch, all of that sort of thing. At this point, my understanding is they would all get, if it's determined they had close contact, they would be in the self-monitoring protocol for 14 days. That's my understanding. What I'm guessing, and again, this is just Bret, this isn't a statement from DHD number 10, but my guess is the way this is unfolding, if there's a case confirmed of a student in the school, more than likely I see parents saying we're not sending our kids back to school. So in a roundabout way, it's going to be that school closing anyway, because you aren't going to meet your, I think isn't it 75% of a daily tally for that day to count? I'm assuming that as soon as there's a case in that school, you're going to lose, at least the 25% of kids, parents who aren't going to send their kids to school, and therefore school's going to close anyway. But that's just my opinion.
A question from Scott. When will common language for schools and health departments be available? We really need to inform our communities.
I'm going to have Janine jump back in here, but I will say that we have already done some school-specific outreach with information. But Janine, if you can just jump on here again and answer that yourself, I'd appreciate it. *6.
Yep, absolutely. Yep, I'm back on. We absolutely have information available, packets and posters and flyers available. If any school would like this information, we can get that to you. Dr. Morse is our medical director, and she is our voice for the health department and sends information to schools, as do our public health nurses in each of our jurisdictions, communicate regularly with schools. So we'll be sure to give them the appropriate information so they can provide it to you. But if in the meantime there's something specific that your school needs or wants, please reach out. You can reach out directly to me or to Bret. You can email info@dhdten.org. I'm going to put that in the message chat area here. email for questions or needs. Please email us and we will be sure to get information to you specifically for your schools.
I have another question from Cheryl. If schools are closed, would staff be paid?
That would be totally dependent on the school system's policy. The health department wouldn't be involved in that at all. So that's something you'd have to talk to your administration about.
A question from Amy. There is a concern for our maintenance staff. Any helpful thoughts on how they will stay safe?
Yep, I guess a couple things that come to mind is one, remember that this is droplet spread. So there's a term called PPE, personal protective equipment. So what that means is it's gloves, it's masks, it's gowns, it's booties, you know, anything that like a healthcare worker would wear to prevent blood or respiratory fluid like a sneeze from getting on them. That's what we call PPE. So in this case, as long as maintenance staff are wearing appropriate PPE while they're cleaning, the risk for being infected with COVID-19 is very low, because again, they have to get it into their body through an eye, a nose, a mouth, and more than likely that wouldn't occur in the process of, you know, disinfecting a school, for example. The only caveat to that is, and this is where a lot of healthcare workers get into trouble, is when they remove that PPE, they have to do it correctly so that they don't, you know, you could be wearing gloves, but then if you take your glove off wrong and you touch it, you know, you touch your other hand to this glove, you can now transfer the virus to your hand. So I guess that's a long answer to say, as long as they're wearing appropriate protective gear and that they remove that gear correctly, they should be fine doing their daily job.
And where would you get those supplies? Same question, add on.
So I'm guessing, so as an example, I would think they already have it. And here's, I don't know 100% that they do, but here's the example that I'm thinking of. I believe if a child gets sick and actually, you know, throws up in the hallway, I believe they have a process for cleaning that up. So I'm assuming they're using, you know, disinfectant spray, and I'm assuming they're wearing gloves. You know, as long as they're doing that kind of thing, as long as they have that type of equipment for dealing with that type of situation, for the most part, it would be the same for this COVID-19. Other than like the masks, but the masks at this point we are not saying is recommended for anybody other than a healthcare worker who is in direct contact with someone who's sick with COVID-19, which a maintenance staff person at least shouldn't be in direct contact with a sick student.
One more thing, two more. From CJ, store shelves are empty of hand sanitizer and such. Is there somewhere these items can be found for schools? And I can answer that for healthcare if you want, Bret.
Yep, go ahead.
The answer is no. Unfortunately, there is no stockpile of these items. People are buying these items out from store shelves and stockpiling them at their homes. We've heard about people buying pallets of toilet paper. So I currently have hospitals that are struggling to find hand sanitizer because even their suppliers are out of it also.
And then I would just add, from public health perspective, the hand sanitizer is for when you're in a situation where you can't get to a faucet with soap. Faucet and soap is the #1 best option. So if you have the ability to get to a faucet, scrub with soap, wash it off, that is the best option for you. If you're somewhere, you know, think of like a baseball game, a high school baseball game, and they got the porta potty out there, that's when the hand sanitizer comes in. So hand sanitizer is not better than washing with soap and water. It's an alternative if you can't get soap and water. So just keep that in mind. Okay, we are at 4:34, so I'm going to give like a couple minutes for the last couple questions, and then we will have to call it a day. Any other last questions you want to throw out there?
Yep, there's 2 more here. I was told today by a supplier that the supplies are only being used for medical clinics, anything medical related. They are not selling to schools holding for medical fields. Any thoughts?
Yep, I think, Luke, you just touched on that. Part of that is because in the medical facilities is where they're actually going to be dealing with these patients. So that's a priority area. And the second part, the problem is that early on, as the general community got wind of this, they started buying up all the sanitizer and stuff. So the supplies are depleted. And unfortunately, there's just nothing we can do about that at this point until more is manufactured.
And the last question is wiping down with bleach water solution helpful?
Yes. So the DHD number 10 response is the CDC says use an EPA hospital grade disinfectant. So if you're using that, that's fine. My understanding is if you use the appropriate bleach to water solution, that would be fine. Okay, everybody. Again, thank you for taking the time out to get this information. I hope that some of it was useful for you. If you have additional questions, want more information, what have you, Janine talked about contacting her or contacting me, but probably the best option for you is just calling the main number of your local county health department office. So DHD number 10 has a office in each of our 10 counties. So for example, if you're in Manistee, we have a Manistee County office. If you just call that office, our staff have been educated on how to get those requests to the appropriate internal health department staff, and then we will follow up with you. So with that, thanks again and have a great day.